All right, cardiovascular system. So the heart, blood vessels, and of course, the thing it's pumping, blood. So two circuits, one to the lungs, one to the body, and it's circulating oxygen and CO2, and of course, nutrients and waste. So the two circuits, we got the pulmonary circuit. So that's going to go to just the lungs. Which side of your heart pumps to the lungs? Right or left? Left. Okay, we'll think about it. And then the other circuit is to the body. Which side of your heart is bigger? Okay, let's figure it out. So, which side needs to be bigger to pump to the body or to the heart? Do I need a pump just next door or to the whole body? So which side needs to be bigger? To the body, right? This is just to the lungs. The lungs, the heart just needs to pump to the lungs right here, right next door. So is this the right side or the left side? The right side. Because when you put your hand on your heart, it's on the left side, the bigger side. So this is your systemic circulation. So the left ventricle pumps to the body. The right ventricle just pumps to the lungs. So that should make sense. Smaller, just pumping next door. Veins and arteries. Which way do veins go? To or from the heart? Arteries. Uh-oh. A is for away. Very good. Arteries send blood away. Does it have to do anything with oxygenation? No. A is for arteries always take blood away from, I should make a heart shape. Veins always take blood back to the heart. So you got to be very careful because in the pulmonary, it's different. Here I'm blue, I'm going away from the heart. What am I? Away from the heart. I am an artery, but I'm deoxygenated. I'm going back to the heart. I am a vein. However, I just came from the lungs, so now I have a lot of oxygen. So artery and veins has nothing to do with the oxygen content of the blood. It only has to go with direction of flow. Veins flow to the heart, arteries flow away from the heart. Not in this class, but in your anatomy class, you'll need to know the tracing of blood throughout the entire circulation. So for us, we'll start here, vena cava. So we got one on the top, one on the bottom. That takes blood to the right atrium. Through this valve here, called the tricuspis, which ends us up into the right ventricle. Where does the right ventricle pump to? The right side of the heart pumps to the lungs, right? So away from the heart is the pulmonary artery, right? Because it's going away. However, there's not oxygen. So let's see, that's 4, 5, 6. To the lungs, back from the lungs are the veins, right? Because it goes back to the lungs. Then we're in the left atrium. What is this? 5, 6, 7, 8. Through this valve here, mitral valve. Left ventricle, 10. And then out the aorta. We'll ignore the other valves. Right? So tricuspis versus bicuspis. Which side is the tricuspis on? All right, your mnemonic device. Well, I'm going to try to get it right. So the tricuspis valve is on the right side. So the bicuspis valve is on the left side. Its other name is the mitral valve. So it has two names. Technically 3. Angio, generic, could be a vein or an artery. But your aorta, is that a vein or an artery? the largest artery. It's about 1.5 inches right above your heart. Artery is artery, arterio. Ather is fat, so be very careful. There is arthrosclerosis and there's atherosclerosis. So one is just the artery hardening, the other is hardening due to fatty plaque. Cardi, where you have heme. What's heme? Blood. What's an angio? Vessel. So they just put a compound together. So it's just a blood vessel. Around the heart, pericardium. And then phlegm. What's the chemical symbol Pb? Lead. So that's what they used to use for plumbing. So that's what they used to measure pressure, lead. So sphygmo is pulse. You will use a sphygmomanometer. So it's a handheld pressure measuring device. Thrombo is clot. Vas, any vessel. So the vas deferens is not a blood vessel. It's just any tube. So just a vessel. The heart has 3 layers and then a sac around it. But they give the name cardium, pericardium multiple times. Right? So we have visceral versus parietal. Visceral means against the organ. So the membrane that's physically attached to the organ is the visceral membrane. The membrane that lines the cavity, the body cavity, that is parietal. So let's go to the heart layers. So the inner layer is the endocardium, the muscle layer is the myocardium, and the outer layer is the epi. So epi for above. Now you also have a heart sac. So the heart is actually inside its heart sac, so it doesn't cause any rubbing against the chest cavity. All right, that heart sac is called the pericardium. Peri for around. So the confusion comes in when they add in the term visceral pericardium and parietal pericardium. And as long as you know the difference between visceral and parietal, you should be okay. So visceral is organ. So if it's touching the organ, in this case the heart, then that is the visceral pericardium, which is the same as the epicardium. So these two terms are interchangeable. The heart sac, right? The sac that the heart is in, that's the pericardium. But since it lines the cavity, it's also called the parietal pericardium. So these two are the same. Four chambers. Top chambers, of course, are the atria, and the bottom chambers are ventricles. The term ventricle actually means empty space. So when they first were dissecting human bodies, all the fluids were drained. They cut into the heart, it was empty. So they called it a ventricle. 4 valves that prevent backflow. So we know the tricuspid and mitral valves, right? That's from the atrium pumping blood down to the ventricles, right? So that's the valve. And then when the ventricles contract, they pump blood up, right? So that is your pulmonary semilunar valve and your aortic semilunar valve. So those regulate blood flow from the ventricles out to the lungs and from the ventricles out to the body via the aorta. So here is that image. You are looking down at your heart. So if you're looking straight down at your heart, this is the image you would see. So this is the right side, this is the left side. Which valve? Whoa, wait, never mind. I said it right, but I labeled it wrong. So you're looking at your very own heart. So left side is left side of this image, and then right side is right side of this image. So the atria are going to pump blood from the top down through these valves. Right? So atrials contract, blood goes down, and then when the ventricles contract, blood is pumped up through the semilunar valves. The third name. So the mitral valve, what's the other name for it? Bicuspid. The third name for it is the left atrial ventricular valve. Because what's in between the atrium and the ventricle? A valve. So now they're just naming it by its anatomical position. So if I say right atrial ventricular valve, you're going to say tricuspid. I'll try to get it right. If I say left atrial ventricular valve, you're going to say mitral or bicuspid. So 3 names for the same part. Blood vessels, of course, is where blood flow is. Expand and constrict to increase or decrease flow, or pressure for filtration. Major arteries. So brachial, upper arm, radial, thumb side or pinky side? Thumb side. Popliteal, so behind the knee. Patella is front of the knee. Popliteal is behind. And then the front of the foot. Dorsalis pedis. Have you guys heard of a CVC, central venous catheter, or a PICC line? So for certain drugs, like chemotherapy, so instead of getting poked all the time, they're actually going to put a surgical site into your vena cava. So that's the central venous catheter. They can also put in a PICC line, peripherally inserted central catheter, where they'll start it here, but they'll insert a tube that leads to your vena cava. That way, the drug isn't being infused down here, it's being released all the way down here, where there's a larger blood volume. Veins. So you have your jugular in your neck. What's the artery called in your neck? Your carotid. Carotid. So you have carotid and your jugular. Subclavian, femoral vein. So anywhere there is an artery running alongside it is a vein. They run in tandem. What is normal blood pressure? So you want to be below 120 over 80 as much as possible. The top number is when your heart is in systole. That's when the ventricles are contracted. And the bottom number is when your ventricles are in diastole. So systolic pressure, diastolic pressure. Electricity. So the heart can make its own beat. And the pacemaker is the SA node. It can give you about a 60 beat per minute rate. And what overrides it is the nervous system. So the nervous system can send a signal to say, speed up a little bit or slow down.
I have a question. Is it true that 12 beats, that means blood is made like a full cycle?
Within your body?
Yes.
I'm not sure how fast. I think it's supposed to be like a minute or something. So 12 beats, probably about 60 beats. Yeah, so it depends on who you quote. So the SA node will stimulate spontaneously an electrical signal. The atriums need to contract at the same time. So the electrical signal will extend from the right side, so this is in your right side, to the left atrium. Right, so that's what these are, the junctional fibers. And then your secondary pacemaker is the AV node. It can produce about a 40 beat per minute pace. However, that's not very successful for life. So if your SA node gets damaged, the AV node can take over for a little bit. but you'll need definitely help. All right, so the heart is going to contract at the apex. So it actually contracts down here at the bottom first. In order to pump blood up and out, I got to squeeze from the bottom. So I'm going to send that electrical signal down the center. So those are going to be called the bundle branches. So when they go down, they're bundle branches. But when they start going and curling back up, they're called Purkinje fibers. So His, bundle of His, or bundle fibers are descending, whereas Purkinje fibers are ascending. Prehypertensive. So you're getting close to 140 over 90. Why do they call high blood pressure the silent killer? Yeah, you don't know? Why don't you know? Don't you get checked out every year?
Not every day.
Not every day? Right. Yeah. So usually there are no symptoms to elevated blood pressure. The only time you actually feel symptoms is when it's already taken its damage. So what are some symptoms of high blood pressure? Dehydration? High blood pressure? No. Sometimes you have too much blood. Right. So I'm talking about the symptoms. What are the symptoms? So you might get a headache. Might have vision problems, right? You go blind. Too much pressure in the eyeballs. The kidneys now have to work twice as hard because there's so much pressure. So once the kidneys start failing, you start going blind, you start getting these intensive headaches, it's already done its damage. High blood pressure partially killed you already. Do babies use their lungs inside the womb? Lungs. What are they sucking in?
Amniotic
Fluid. So, would it be smart to pump blood to the lungs if I'm still inside the womb? Would it do anything? Are you going to pick up oxygen? No. So you're going to get oxygen straight from the umbilical cord, and it goes to the right atrium. Right? Normally we go to the right ventricle, go to the lungs, and then we head back to the left atrium. So there's a hole in the heart that allows for contents in the right atrium to just jump the septum and go into the left atrium. So that hole is called the foramen ovale. It needs to close, or usually close, before or shortly after birth. So here we got the placenta blood supply. So it goes to the veins, or sorry, goes to the liver, ductus venosus, and then it just goes straight here to the right atrium. And then the foramen ovale is the hole. It just skips over to the left side and then goes into the ventricle, out to the body, bypassing the lung altogether. Here's a recording of a blood vessel. Where do you see that there might be a problem with this patient's blood vessels? Bottom. Are you sure? Top? I see some narrowing right about there. You see how that blood vessel kind of kinks in a little bit? So that might cause a blockage. And then this whole thing that's being fed by that blood vessel branch starts to die if it lacks oxygen. So death is called infraction. Rhythms, AFib, VFib. So atrial fibrillation can lead to blood clots and stroke. Ventricular fibrillation, that is a heart attack that requires a shock. So you'll learn to use the automated external defibrillator in your vital signs and CPR class. What does Brady mean? Yeah, good. So this is a heart rate below 60 beats per minute. Tachycardia, that's a heart rate above 100. So what's normal? Between 60 and 100. Palpitations. Palpitations are when you're able to recognize your own heartbeat. So if you can feel it or if there's irregularities, then that's palpitations. Sometimes when you get scared, right, you can feel your heart jumping out. AV block. So we got a dub love, dub love, dub love, dub love, right? So there wasn't a communication. So they can see that on your EKG. So you have the P, QRS, and T. So this is the atrials contracting, this is the ventricles contracting. So they can see an AV block because there'll be a P wave, no QRS, P wave, QRS. For blood pressure, it could be a heart condition that caused it altogether or something else. Like for example, anti-diuretic hormone. If you have too much, then your body's going to hold on to water. And that's like too many cars on the freeway. It's going to cause congestion if you have large blood volume. So it'll damage, high blood pressure will damage the delicate blood vessels and capillary beds. Notice the inner surface, relatively nice and smooth on the inside, and whatever's here in red is muscle. Right? So arteries have a lot of muscle because they need to withstand the pressure, and you have to be able to constrict and dilate. So the muscle layer is what allows you to open and close blood vessels. In a fatty condition, atherosclerosis, you have fat that is stored within the blood vessel. And the problem that arises is narrowing, so you have stenosis, less flow, but also the edge can rupture and then release the contents. If it travels to your brain, you get a stroke. If it goes to your heart, myocardial infarction. If it goes to the lungs, pulmonary embolism. Any vein, you might get a deep vein thrombosis. Artery, heart, and lung disease. When they transplant a heart, a lot of times they'll transplant the lungs as well. So you'll get a 2-for-1. So there is a machine called the heart-lung machine that the person's body will be hooked up to during that procedure. What's the best exercise for your heart? Just walk. We're designed to walk all day. So if you just walk, it's going to really help your cardiovascular health. Angioplasty. So here we got a collapse, stenosis of a blood vessel due to fat atheroma. So that's a fatty plaque, fatty tumor. So usually this is done from the leg. They'll insert a line from the leg, and the stent is actually collapsed. So they'll fish it into the part of the artery that they need, and then they'll fit in the balloon. Right? So the balloon will be inflated, and that wire mesh will then expand, and hopefully that will push the fat and open the blood vessel. Right? So here they're just doing it to stretch, no stent. But here you can just slide in a collapsed stent, and once it's inflated, your stent opens up, and hopefully that will prevent a heart attack. So here's the stent. It's just metal. Sometimes they're impregnated with medication to prevent the overgrowth of the plaque. All right, not too bad. Let's go to the assignment. It should be open.